Hi everyone, my name is Jason Bruse. I'm a podiatrist here in Layton with the Ogden Clinic. I'd like to take a minute today to talk a little bit about bunions. It's one of the most common problems that I see in my office. I want to start with showing what a bunion really is. A bunion is more complex probably than most people realize. It's actually a deviation of, this is an x-ray of a foot, and this is what's called the first metatarsal bone. This is your big toe joint right here, and a bunion is when part of the big toe joint sticks out and it rubs, and it usually forms a pretty big lump on the side of your foot. It hurts in shoes, and it's more complex than just a growth of bone growing right here. What a bunion involves is actually this entire first metatarsal bone actually deviating out away from the rest of the foot. And the proper fix for bunions really matters. I see a lot of people who get surgery on bunions and they find that their bunion came back, and you may have heard someone who's had a bunion surgery and the bunion came back a year or two later. That does happen, and that is common, and the main reason for that is that patient had the wrong bunion surgery. So the message that I really try to get out to people is, if you're going to have bunion surgery, get the right surgery, because if you don't have the right surgery, you won't be happy that you did it. So I want to explain very quickly what that means. It makes sense after looking at this x-ray. If you want to fix a bunion, what you have to do is actually pull this whole bone back straight so that it's now parallel with this bone. And this is a post-op x-ray of mine, and you can see what we did here. So this bone is here deviated here, the first metatarsal bone is deviated. We pull it back straight, and a bunion is actually, the problem and the cause of a bunion is actually way back here in the middle of the foot. I'm going to show on this right foot bone model where a bunion actually occurs. What happens here is, in a bunion, this bone actually moves out away from the rest of the foot. And the problem actually exists way back here in the middle of the foot. This joint becomes too loose, and when that happens, the whole bone starts to move, and when that happens, we get a bump that develops on the inside of the big toe joint. And in order to fix a bunion properly, we have to straighten that bone back up and actually fuse this joint back here. So we take out the cartilage between these two bones and get these two bones to fuse together. And when that happens and we get this to fuse together in the right position, you can't get a bunion back again. There are some other bunion surgeries out there that do allow for a bunion to return. If we just knock the bump off here and cut the bone out here and slide it, that does fix the bump, but oftentimes that's a temporary fix and patients are then unhappy down the road. So I like to talk to patients all the time about this concept. If you have a bunion, get it fixed the right way. If you don't get it fixed the right way, you likely will be unhappy down the road. I want to show just a final x-ray here. This is again a preoperative x-ray. You can see the big angle here of the first metatarsal bone. The problem for a bunion actually exists back here in the middle of the foot, and this is after it's been fixed. This has a rod inside the foot underneath the surface of the bone, and we actually pulled the bone back straight. This bone and this bone are now parallel. The bump is now gone, and this will stay like that forevermore. So that is the right fix, and if you're going to get a bunion fixed, I recommend you do it the right way.